Presented expert system was created taking into account clinical guideline on diagnosis and treatment of arterial hypertension developed by the Russian Medical Society on Arterial Hypertension. At the initial step, the experts, using experience and knowledge in the subject area, create an ontology that describes main arterial hypertension influencing factors. Here you can see its small fragment. One of the main factors of arterial hypertension is high blood pressure. The expert selects data type list and indicates that there are three stages of arterial hypertension: first, second, and third. Each stage of arterial hypertension is characterized by a certain level of systolic and diastolic blood pressure. The expert, using data type list, inserts necessary knowledge. To save all data into the knowledge base, press Save button. Next, the expert completes cardiovascular diseases risk factors section. Here are some examples. Gender risk factor. The expert selects type of the answer yes or no and indicates male and female. Age risk factor is described by two parameters, gender and age, and the answer to the question about age risk factor will be yes or no. Gender has two previously indicated variants, male and female. As for age, according to clinical guideline, for male, the age more than 55 is the age of increase of cardiovascular risk. For female, more than 65. And to indicate absence of the risk factor, we use age less than 55 and less than 65. Smoking risk factor. To describe this risk factor, the expert uses yes-no answer type, and the answer to the question about presence or absence of this risk factor will be yes or no. At the next step, the expert forms combination of characteristics that are used later to get final conclusion about health status. To determine arterial hypertension stage, it is necessary to consider all possible combinations of systolic and diastolic blood pressure levels. For example, the first stage is characterized by the following combinations: systolic blood pressure on the level from 140 to 159, and two ranges of diastolic blood pressure less than 90 and from 90 to 99. And the second combination is systolic blood pressure less than 140 and diastolic blood pressure from 90 to 99. Combinations for other two stages of arterial hypertension are formed in the same way. Gender risk factor. According to clinical guideline, male gender is a risk factor for cardiovascular diseases. So, for the answer yes, we select male. For the answer no, we select female. Age risk factor. For the answer yes, we select the following combinations: male gender and the age more than 55, female and the age more than 65. For the answer no, we select male gender and age less than 55 and female and the age less than 65. To describe smoking risk factor, it is necessary to introduce the definition of a norm. In this case, the norm is the absence of a smoking habit, and its presence is not a norm. Thus, If we answer yes to the question about presence of the smoking risk factor, we indicate that it's not a norm. If we answer no, indicate answer yes, it's norm.